Hi, my name is Taylor Boudreau. I'm here to talk to you today about intussusception. So what is intussusception? So this is a condition in which part of the small or large intestine telescopes into itself. So if you think about what a telescope looks like, part of the small or large intestine kind of slides back in and onto itself. And this can create a blockage where it can trap food, fluid, and air within the small or large intestine. This type of blockage can cause severe abdominal pain and a lot of other symptoms that we'll discuss later. Patients suffering from intussusception typically have pain that comes and goes every 15 to 20 minutes that gradually worsens over time and doesn't resolve. Other symptoms you may see in patients suffering with intussusception is vomiting, bloody stool, jelly-like stool, extreme fatigue, and because of the pain that's associated with this, you may see children drawing their knees to their chest, and this would be in an attempt to relieve the discomfort associated with that telescopic movement of the intestines in and into itself. So who's at risk? Intussusception typically occurs most often in babies and children, especially if they're under the age of 3. And in most cases, we don't really know what causes this. It's idiopathic in nature, so sometimes it can be attributed to certain medical conditions, but for the most part, we don't really know why it happens. So what do I need to know? Some children may present with all of the textbook symptoms of intussusception, including pain, vomiting, bloody stools. Some children may have 1 or 2, and some kids may have no symptoms at all, and it may be an incidental finding. And then for those kids with no symptoms, treatment may not be necessary. If they become symptomatic, you can kind of go from there. But in most cases, you're going to find that patients present with their children and say that the symptoms came on suddenly. And all of a sudden, they were in extreme discomfort and they have not been able to console them. So important questions to ask would be, when did this start? Have they been sick recently? Has this been happening for a couple of days? Or were they fine this morning and now you can't get them to feel better? Have they had vomiting or diarrhea? What does their stool look like? Is it bloody? Has it been bloody for the last 2 and now it's more jelly-like? Things like that can give you more clues as to what's going on. As far as the physical exam, anytime you have any type of intestinal blockage, you're going to want to focus on bowel sounds. So our first exam we could do would be auscultation. If a blockage occurs, you're going to hear maybe hypoactive or absent bowel sounds. So it's important to listen in all 4 quadrants. That way you might be able to narrow down where the issue is occurring. Palpation. Obviously these children are going to be complaining of some abdominal tenderness. Palpation may be tender in these patients, but it's important that we can palpate and kind of feel if we can locate where the issue is starting so we know where to look for issues in our imaging. Percussion. If we're dealing with trapped food, fluid, or air in the intestines, you're going to be able to hear resonance or dullness that may be different than other areas in the abdomen, or it may be different from that patient's normal. And last but not least, just a review of the history. So parents are most likely going to be giving you this information because this occurs in children under the age of 3. Parents are going to be able to tell you if this came on suddenly, if they had been sick, or if they were around other sick children. And all of those things that they tell you can help give you a timeline and clue you in to exactly what's been going on. For diagnosis and treatment of intussusception, the gold standard is going to be imaging. So X-ray of the abdomen or chest, and then an ultrasound. Ultrasound's great because they don't have any kind of extra radiation exposure. And that can kind of give you an idea of what's going on. Treatment could vary. It can be as simple as IV fluids or an air and contrast enema. So that would be inserting air or a contrast type fluid into the rectum to help try and push that intestine back out. NG tube placement could be used for decompressing air or trapped fluid and food to help kind of decompress and reduce that intussusception. And then if none of that is effective, the last step would be surgical reduction. And you can decide that based on the imaging and the symptoms and if the child's progressing and getting better. So thank you so much, and I hope you learned a little bit about intussusception.